Record keeping and audit process. Introduction to the module. An audit's goal is to ensure that policies, care plans, medication management, and other related documentation are operating in accordance with policy. Managers must show that their employees are participating in assessing their levels of service when being audited. A medication administration record, MAR, is a report that serves as a legal record of the drugs delivered to a patient at a facility by a healthcare practitioner. It is also known as a drug chart. The MAR is a part of a patient's permanent medical record. Learning objectives. After completing the module, you would be able to manage the legal and practical documentation of medicines and their errors. Revise how to perform the audit, monitoring and review of documents. Review how to keep a recording of the medication history of the patients. Realize the possible reporting losses or misuse. Documentation. Person-centered documentation should be employed to ensure the safe administration of medication by each organization. Documentation may differ depending on the policies and processes of the organization. However, there are specific documents that should always be included in medicine administration processes. The Medicine Administration Recording (MAR) chart is used to keep track of the medication's name, dosage, administration times, how medicines are being taken, and a record of administration. Everyone has their own recording sheet. The care plan or personal plan may include information about the medication that the individual is taking, the diseases or symptoms for which it is prescribed, and how it should be administered, as directed by the prescriber or pharmacist. More information about the person's unique background and preferences should be included in the care plan. Following a patient's care plan might allow healthcare workers to provide medication in a way that supports their health and respects their preferences. Choices can include, for example, how they wish to be supported, how they can be actively involved, any preferred routines. Errors. Errors should be viewed as opportunities to learn and improve the overall safety of the healthcare system. The development of a learning culture is a good practice in managing errors. Certain pharmaceutical errors should be reported to the Care Inspectorate by the organizations. Other bodies, such as the GP, general practitioner, or the NHS, are usually obligated to submit reports. You must disclose it as quickly as possible if you make a pharmaceutical error according to your organization's policies and procedures. You may feel worried, but you must be open and honest about the mistake to ensure that any negative impact on the individual's well-being is minimized. Through monitoring and training, your employer has a responsibility to ensure that you receive suitable support. Audit, monitoring and review. Audit tools are offered in the Management of Errors Policy, Independent or Supplementary Prescribing Policy, and Controlled Drugs Policy, as well as service-specific audit tools. It should be done to see if the policy has been implemented or acted upon. All monitoring and operational audits should be submitted to the Drugs and Therapeutics Committee for review and action. Service managers should make sure they have mechanisms in place for auditing and reviewing pharmaceutical incidents on a regular basis. When revising this policy, changes in local guidance, national legislation, and best practice should all be considered. Pharmacists monitor the prescribing and delivery of medication on inpatient wards and units by reviewing all prescription paperwork on a regular basis. The nature of the ward or unit determines the frequency of pharmacist monitoring. A program of regular quarterly and 6-monthly audits undertaken by pharmacy staff monitors comply with the parts of the safe and secure handling of medicines policy. The Medicines Management Group agreed upon additional medication-related audits as part of a 3-yearly Medicines Management Audit Program or as part of the POMHUK, Prescribing Observatory for Mental Health, Audit Program, as needed by NHS. Aspects of the procedural guidelines which may be audited via these programs include controlled drug storage and safekeeping, including stock reconciliation, fridge temperature monitoring, compliance with prescribed standards, prescription chart audits, medicines administration, medicines reconciliation, medication transfers, transport of medicines, supply of medicines to wards and departments, self-administration, disposal of medicines, high-dose antipsychotic prescribing, safe and secure storage of medications, antimicrobial prescribing, record keeping, charts for medication administration records, MAR, shows a patient's medications and doses, as well as information about when the doses were given and how much was given. It's also crucial to keep track of when recommended medication isn't administered. When drugs aren't administered, another letter codes can be used to keep track of them. The meaning of the code must be explained in the MAR chart. A person's care plan should be used to supplement the information on the MAR chart. Personal preferences, such as whether the care provider who administers the medications should be of the same sex as the individual, will be included in the care plan. The MAR chart can help the care provider keep track of drugs that aren't requested every month but are only taken once in a while. The provider can use the MAR chart to record drugs that have been carried over from a previous chart. It is the responsibility of the care provider to give MAR charts. The pharmacists and/or dispensing GPs are not responsible. However, they may be willing to supply them upon request. Although MAR charts used in care homes and domiciliary care resemble prescription charts used in hospitals, they are not interchangeable. The MAR chart is merely a record of what care medical staff give to patients who need care services, and the care provider owns it. It is not a chart that may be used to prescribe medications. The Royal Pharmaceutical Society of Great Britain has also issued recommendations on the delivery of MAR charts to pharmacists. Reporting losses or misuse. The senior ward or unit nurse must report the loss or suspected loss or misuse of any medicinal product to the chief pharmacist in accordance with the standard operating procedure, according to Medicines Security, MP2. For controlled medications. If any medical product is accidentally damaged, note it on the patient's medication sheet and, if feasible, have it countersigned by another nurse or, if in the community, the patient, carer, or relative. The chief pharmacist must be notified in the case of controlled substances. The senior nurse must notify the finance department of any loss under the trust's standing financial instructions, but there is no duty to report losses regarding patients' drugs. Highlights of the module. The Medicine Administration Recording (MAR) chart is used to keep track of the medication's name, dosage, administration times, how it should be taken, and a record of administration. Errors should be viewed as opportunities to learn and improve the overall safety of the healthcare system. The Royal Pharmaceutical Society of Great Britain has also issued recommendations on the delivery of MAR charts to pharmacists. Service managers should make sure they have mechanisms in place for auditing and reviewing pharmaceutical incidents on a regular basis. A program of regular quarterly and 6-monthly audits undertaken by pharmacy staff monitors comply with the parts of the safe and secure handling of medicines policy. Great job! You have successfully made it to the end of this module.